The cancer treatment industry has evolved into a highly profitable business, where pharmaceutical companies make billions from chemotherapy and radiation therapy. Although these treatments rarely address the underlying cause of cancer, they create a steady source of income for the companies that offer them. Many patients are kept in treatment indefinitely, contributing to the continued revenue stream, while natural or alternative remedies that may be more affordable are often dismissed. The industry thrives on the ongoing treatment of diseases, rather than seeking permanent cures, creating an endless cycle of dependency. Cancer isn't the only example. Similar patterns emerge across other illnesses, where treatment focuses on managing symptoms rather than curing the root causes. Exercising regularly and maintaining a healthy lifestyle can often do more to reduce the risk of illness than relying on expensive treatments that profit off prolonged sickness. Mental health remains one of the most underfunded areas in healthcare, with pharmaceutical companies profiting from long-term sedative prescriptions that don't address the root causes of mental health disorders, while patients continue on a cycle of medication. They rarely receive comprehensive treatment that addresses the underlying issues. The pharmaceutical industry profits by keeping patients dependent on medications for life, rather than promoting effective, holistic therapies that could lead to recovery. This exploitation of vulnerable individuals results in millions not receiving the support they need, perpetuating a system that profits from maintaining their conditions. In many cases, these drugs may cause harmful side effects, and their long-term use is more about maintaining corporate profit margins than improving patient well-being. The healthcare industry has long been tainted by scandals involving the concealment of critical information regarding the side effects of drugs. Pharmaceutical companies often hide or downplay serious risks to keep products on the market, all in the name of profit. A prime example is the widespread use of antidepressants that have been shown to cause severe side effects, yet this information is often hidden in marketing campaigns. This manipulation leaves patients unaware of the full risks they are taking when they use these drugs, ultimately leading to further harm. The lack of transparency in the medical industry results in millions of people being subjected to potentially dangerous treatments without being fully informed of the consequences, all for the sake of profits. Throughout history, the healthcare industry has faced accusations of using vulnerable populations as unwitting test subjects for new treatments and drugs, in the past, and even today. Some clinical trials are conducted without proper consent, with patients often unaware of the risks involved. Many patients have been used as guinea pigs for corporate-sponsored studies, often without the ethical oversight required. For example, clinical trials for cancer drugs have sometimes included patients who were not fully informed about the dangers of the treatments they were receiving. This exploitation of vulnerable individuals continues in some parts of the world, with pharmaceutical companies prioritizing profits over patient safety, resulting in unethical research practices that violate fundamental medical ethics. The global health insurance system is a web of inequality, with insurance companies regularly raising premiums and reducing coverage, all while profiting off the sick and uninsured. The wealthy have easy access to top-tier healthcare services, while lower-income individuals struggle to afford even basic care. The disparities between social classes are stark, with the uninsured being left without coverage or care, while insurance executives see record profits. The health insurance system's unfair nature perpetuates the wealth gap, with those who need help the most being the least able to access care. The increasing cost of healthcare and the lack of access to quality services for those at the bottom of the social ladder result in millions of people suffering without adequate medical support.